This is a quick guide on how to do it yourself, research for understanding your options under the Medicare Part D program and drug plan. So let's go to the next page and start talking about Medicare Part D. All right, annual enrollment period, also known as AEP, starts each year, runs from October the 15th through December the 7th. At this time, when you can make any changes to your Medicare Part D plan or a Medicare Advantage plan for the upcoming year. This video, it does not discuss how to review Medicare Advantage plans. This is only for people who have a Medicare Part D plan or for someone who wishes to leave a Medicare Advantage plan and return to original Medicare with a prescription drug plan. Right. If you are new to Medicare and enrolling in the first time, your enrollment window is determined by your Medicare Part B effective date. So that window is 3 months before you turn 65, the month you turn 65, and 3 months after you return 65. So you want to start looking at your options. Generally, we do it 3 months before you turn 65. But also remember, Medicare Part D plans start the first of each month. So you generally can enroll through what we're going to show you up to 12 o'clock the night before. We typically tell people to do that earlier than that, just so they have time to get their cards and information packet in the mail. All right, so there are different ways to research Part D. The first option is you can call Medicare directly, 1-800-MEDICARE, 800-633-4227. We typically recommend calling later in the evening. Just understand that they are open 24/7. They can walk you through the process we're getting ready to show you how to do. You can also look at your local SHIP contact. Just Google your state and SHIP contact. You should be able to find someone, a local volunteer, that would help you do this same information, same process, I'm sorry. The third option is to watch this video and do it yourself. We recommend watching the video to understand what happens even if you call Medicare or work with SHIP. It gives you a good understanding of what they are doing if you don't want to do it yourself. All right, so let's review the basics of Medicare Part D for 2017. These numbers change each year. So the deductible this year is going to be $400. That's the first phase. Some plans have deductibles, some plans do not. The next phase is the initial coverage phase, where you pay 25% of the cost of the medicine. The plan pays 75%. The third phase, which most people are familiar with, is called the donut hole. You'll pay 51% of generic costs or 40% of brand costs. After you leave the donut hole, you go into catastrophic coverage, where you pay $3.30 for generics, $8.25 for brand names. What we like to first do is go to the official U.S. government site for Medicare. Now, in order to get to that, up in your URL, or where you would type in the web address, you would type in Medicare.gov, G-O-V. So that is the official U.S. government site for Medicare. Once you land on this page, this is what it will look like. And you'll look for this Find Health and Drug Plan, a little magnifying glass. You want to click on that and let that come up. All right, so what you want to do here, this is the Medicare Finder Plan tool. We want to enter in zip code. So we'll just put in my zip code, the great town of Faison, North Carolina. So we'll put that in. And we are in Duplin County. And then what we're going to first say is we are on Original Medicare. You can ignore these two drop-down questions. They're not important at this time. We're going to also put in, I do not get extra help. If you do get extra help, you can check that. And let's say we go with level. If you know that, because extra help can change, throughout the year. I generally do this just a comparison.
Put that
Just
in,
to choose I don't get any extra help.
and
Click continue to plan results.
tour of a state.
So what you have here are two different ways to enter your drugs. You can enter them in one at a time, or if you've already entered your list of medicines in the past, what you can do, if you have this information, you can pull that up because it's stored in their system. Or you can, if you have a drug list ID, that will be a series of numbers and then a particular password date. Now, what that is, that date corresponds with the first time you entered in your information into Medicare.gov. In some cases, it can go as far back. All right, let's use, but in this case, we're just going to enter in 2 or 3 common medicines. Let's go with simvastatin. So as we type them in, we'll go with you'll see that Medicare's website. If your dosage is different, automatically click on that box. Suggest. If your frequency, the amount of time you take it per day is different. Dosage and frequency, so that we have the correct information. All right, so what will happen is it will enter that medicine down here on your drug list. What Medicare's site will do will automatically correct, or excuse me, what Medicare's site will do will automatically generate a drug list ID for you. And I'm doing this on October the 13th, 2016. So it is going to use that as the password date. So if I were you, I would write this information down if you're doing this on your own. That way you can come back to that without having to enter in your medicines each time. You can do this every year. We've got some clients go back many, many years with this. But once you've done that, click My Drug List is Complete. And then they're going to ask for the number of pharmacies in your area. So you need to expand that if there are not very many options available. So we're going to use our local pharmacy here. And then also we have a Walmart. I always pick a Walmart just to throw it in there. The system will only allow you to compare 2 at a time, 2 pharmacies. So if you have other pharmacies you'd like to compare, you might want to take some notes when you get to the plan results or print them off and then come back and change your pharmacy and run the comparison again. But we'll continue on the plan results now that we've picked 2. And then what we're going to do is on step 4 of 4, we are going to click this top one, prescription drug plans with original Medicare. All right, there are 22 available. We're going to click continue to plan results. And so here, Medicare's website will sort all the different plans available to you in your zip code. In my zip code, there are 22 plans. So what it will do was its first default sorting will be the lowest estimated annual retail drug cost. And this is pretty common. It's probably what you want to use. There are a couple things you want to start comparing at this point. Then the first one is going to be to make sure all your medicines are on the drug formulary. So the formulary is the list of medicines that particular plan carries or covers. You want to check that and make sure that says yes. Are there any drug restrictions? We'll look at that in a little bit, but there's a yes there. The next important number you want to focus in on is the estimated annual drug cost. So what this number is Medicare's system will take your monthly premium, any deductible, and any co-pays for the list of medicines that you have entered and spits out a number that says this is what it would cost you using this plan to go to one of the pharmacies you've entered. That would what it will be for the year. So that would be all your monthly premiums times 12, that number of months left for 2017, any deductible that might apply, and the co-pays for your medicines. So again, that number is the most important number you're going to look at. That's going to be the best estimate or best way to compare all the different plans. If you like the idea of using mail order, you want to use this number to compare. But as you see, Medicare will sort them based on these numbers again, and this will go up. Excuse me. This will go up as we go down in the list. See that increases every time. Again, this is going to be different for everybody depending on their particular list of medicines that they take. So we're going to first start with this top plan. We're going to click the plan name itself, and to get into a little more detailed review of that particular plan and your medicines. So in here we are looking at the 2017 data. If you're enrolling in Medicare for the first time and you start either October, November, or December, you might want to look at the 2016 data. But if you're just in your annual enrollment period, AEP, you want to look at this 2017 data. So we're going to scroll down. First, review the cost of the plan, $14.60 a month here. Drug deductible, $260. So what you see here, this pharmacy is obviously in network, and this one is not. And then the cost for mail order. So we'll scroll down a little bit, and the next section is going to tell you what each of those medicines will cost for you. So this is Medicare's cost, what Medicare suggests for cost of the drug, and then your cost depending on what part of Medicare Part D or the Medicare prescription drug plan you're in. Cut. What this number is varies depending on what phase of the prescription drug plan you're in. You have a deductible phase, an initial coverage level, the coverage gap, or what people call the donut hole. And then after you come out of the donut hole, then you have catastrophic coverage. So the prices change in each particular section or each phase or level of the prescription drug plan. Um, some plans, if it's generic, they don't change from deductible to initial coverage level. In this particular example, that's the case. The next thing we always like to do is look at the bar chart down here. This will give you an idea of the cost of your medicines. So here it says $7.97 plus the premium of the plan is $23. Those two numbers together equal $23, and that's the cost. Now, if you are on a name brand medicine and you go into the donut hole, or the plan has a deductible with a name brand, you might see it start high here, go down while you're in the initial coverage level, go back up when you're in the donut hole, and then go back down again while you're in the catastrophic coverage. So the next thing we want to do is scroll down and look at any drug restrictions here. Prior authorization means that you have to get authorization from your doctor before you can go on this medicine. Quantity limits, obviously that's one, how many, the maximum number the plan will allow you to fill per month. And then step therapy. Step therapy is if there is a lower cost medicine or generic available, your doctor or the plan may want you to start at that lower one first and then work your way up. You can avoid that sometimes by asking for an exception. But if we click on this, we're going to see the plan breakout. So you can't see that, but it's going to have each of the name brands or each of the name medicines, and then the quantity limits and what they're saying per month for every 30 days, 30 capsules. So that's it. We're going to go back to and close this window. All right. And then we're going to go back up here and return to previous page. Now, well, before we do that, again, we're right before October the 15th. So if you are on the 15th or after up until December the 7th, there will be an enroll button. You'll click on that, and that will actually enroll you into that particular plan for 2017 or the next year if this was later. That will also automatically disenroll you from your plan that you're on. So if you're changing plans, it will automatically disenroll you from your plan December the 31st of the year, and then enroll you in this new plan January the 1st. There are a couple pages you have to go through when you enroll. When you get to the very end, there will be a confirmation number. I would recommend you print that out, and they will have the phone numbers for the plan itself if you want to call. If you want to call them directly, you can just call them there. if that's the particular plan that works for you. But so let's talk about a couple other things before we wrap up here. All right. When calling Medicare or SHIP directly, there are a couple things you should do. First thing is give them the medicines you are taking. If the medicine is in generic form, spell out or read the generic name to the person. Uh, it's probably not a good idea to say, I take the generic form of Lexapro. Just write, or excuse me, just read out or spell out the letters of the generic name so that person can actually use the correct medicine. Second thing is ask to compare plans by estimated annual drug cost. So estimated annual drug cost is the most accurate way to compare the true overall cost of a plan for you. We'll talk about that a little bit in the video run through of Medicare Part D. The next thing you want to ask if there are any prior authorizations required by that plan, a step therapy, or quantity limits. So prior authorization, you have to get prior authorization from your doctor to take the medicine. That can catch people by surprise sometimes. Step therapy is when you have maybe a higher priced medicine and there's some lower cost generics or lower cost alternatives. They may want you to start there and show that you cannot take the lower cost plan or lower cost medicines before moving you up to a higher cost medicine. So sometimes you can get the waived by a doctor, but just be aware of those prior authorization, step therapy, or quantity limits. Now, here are some common mistakes and questions about Part D coverage that we get from our clients. The first one we often get is, can I get a plan that doesn't have the donut hole? Unfortunately not. Every Medicare Part D plan, also referred to as PDP, has a donut hole. All the plans must follow the guidelines laid out by the federal government, and the donut hole is one of those parts of those guidelines. The next thing, uh, last year's plan, I only paid so many dollars for this particular medicine or for the premium. A lot of people confuse last year's plan with what's available for next year. So don't compare last year's plan to this year's plan, even if it's with the same company. Plans change each year. So formularies, which is the drugs that are covered by that particular plan, change. The copays change, premiums, deductibles, and even the pharmacy networks change each year. So you want to feel like you're doing this every year and imagine you're starting from a clean slate. So you don't want to think back to, well, my plan last year paid this. Why isn't why do I have to change? Why can't I just keep what I've got? Because the plans change. The plan you had last year does not exist anymore because again the drugs, the copays, premiums, deductibles, all those things are changing. So you want to make sure that you're kept. You want to run the analysis each year. The next thing is a lot of people will often try to compare plans by just looking at the lower premium. So they might say, but XYZ's plan has a lower premium. Again, comparing plans by premium is not the best way to compare the plan and figure out which one works the best for you. What you want to do is compare your estimated annual drug cost. That number includes premiums, copays, and deductibles, if any. We have seen it often that plans that have lower premiums, right, still may cost you if you get a new medicine mid-year or deductibles. That's a question I get a lot also. So the estimated annual drug cost good way takes into account premiums, copays, and deductibles, and that is a number that more accurately reflects which plan is going to have the lowest out-of-pocket cost for you. What if I get a new medicine mid-year? Well, really, there's no way to know what medicine you might be on 6 months from now. So what we have to do is choose a plan based on your current situation. So if you start a new medicine that's not covered under your plan, you can ask for an exception. or appeal for that medicine. And just realize that the next year you want to include that when you're doing the comparison so you get a better idea of what plan for the upcoming year will cover your medicines. Often we get calls, people who say that their copay just went up and are worried that their plan might have dropped them. This is not likely the case. What's happened is you've probably transitioned into a new pricing phase. If you remember back to the picture of the donut, there are different levels or phases in a prescription drug plan. So the plan that you have might be going into the donut hole, and then all of a sudden the prices of your medicines goes up. Now, for some people, you may never go in the donut hole if you're taking a few generics. Other people, if you have name brands that don't have generics available, or you cannot take a generic because of some reaction, you may enter the donut hole. And this occurs at different times for different people. It all depends on the medicines that you're taking and the cost of those medicines. Saying you take XYZ brand name medicine when you actually take the generic form of that medicine. Again, as I mentioned earlier, when you're taking a generic medicine, read or spell the generic name to the person who's helping you. If you say I take Lexapro and you actually take the generic version of that, give them the generic version of the name. Lexapro being a name brand may cost more. Getting the wrong medicines listed will give you results that might not reveal the least expensive option for you. So make sure you give them accurate names of medicines. And the last thing I'll say is don't wait until the last minute to get this taken care of. Every year, people will call us after December the 7th, desperate to change their plan. At that time, it's too late. You want to make sure you get this done as soon as you can. The earlier the better. You get time to get your cards, you get your welcome packages, and all that. Also understand that when you enroll in a prescription drug plan for the new year, it will automatically disenroll you from your existing plan. So there's nothing you need to do. That will happen automatically. But make sure you get that done. It'll only take you 10 to 15 minutes if you follow this video or call Medicare directly. All right, so that's it. We hope you enjoyed this walkthrough on the prescription drug plan research. We hope you find that's useful for helping you find your Part D plan for next year. Remember, you can call directly with Medicare, 800-366-4227. Again, we usually recommend calling a little later in the evening. You can go online to Medicare.gov and use the Plan Finder tool as we just showed you in the video. There's one more thing. Here's a little time for a shameless plug. If you are on a prescription drug plan, now is a great time to also review your Medicare supplement plan. Maybe you have Plan F or Plan G or Plan N. Just remember in the 2016 Choosing a Medigap Policy Guidelines, or a guide issued by CMS, which runs Medicare, they say on page 9, cost is usually the only difference between Medigap policies with the same letter sold by different companies. So we help clients find the exact same coverage or maybe better coverage for them and lower their rates at the same time. As brokers, we have access to all the top companies and can compare those plans for you in just a couple minutes. And again, there's no cost for what we do to help you. If you want to do that, you can reach us a couple of ways. You can email us at info@mymedigapconsultant.com. You can call us at 888-729-9364. Again, this is a busy time of the year for us. If you get our voicemail, just leave your name and number, zip code where you are, the age, your current age, the plan, and the premium you have now. And either Kent Kingsley or myself, Rusty Williams, will be back with you shortly to see if we can help. Thanks for your time, and I hope this was helpful, and have a great AEP.